I think that is too soon. I mean, looking at the case numbers, they're still quite high. You're seeing a decrease to some extent, but it's still in the 90,000, 100,000 cases per day range. We can't be sure that the drop in cases isn't due to a change in the testing requirements as well, because there was a change from requiring PCR confirmation after a positive lateral flow test. So I think that the drop in cases is maybe not that significant yet, and that maybe it's too soon to ease restrictions because there's obviously still a high caseload across the UK. So I definitely think it's too soon. Honestly, I really couldn't speculate as to why they've chosen right now. It doesn't seem to me to be based on the data. One thing that worries me is that, in fact, if you look at the reporting of the mortality due to COVID, it seems to have actually plateaued in the region around 300-400 deaths per day. And that seems worrying to me, that there's such a high number, relatively high number, for what we had seen for such a long time. Obviously, since the summer, the number of deaths per day had dropped off quite a lot, and it was down to around 100 or less per day, or 100 fewer per day. And now it seems to be up around 300-400 per day. And that tallies with, or is proportionate to, the high number of cases. And so, yeah, I think vaccination has had a huge impact on reducing mortality, but that's still going to be a proportionate reduction. And so if there's a really high number of cases, 100,000 plus, you're going to see an elevation in the number of deaths just by proportion of people who are more likely to be susceptible. So I think that, I just think that it's premature to act on the data so far and say, oh, it's okay to remove restrictions. If that was the reason, if they were thinking, oh, the cases are dropping, it's fine. But I think that if you look at all the other parameters, it doesn't seem like we're out of the woods enough to say it's okay to ease restrictions. And the restrictions, as you say, were not particularly onerous. So what makes me worried about that is that, if you're saying to people, well, we don't need to distance, we don't need to work from home, we don't need to wear masks, what are you actually going to have people do going forward to, as people keep saying, well, keep yourself safe? Isn't it easier to just say, let's keep these measures in place as much as practicable, have people wear masks, have people keep a distance, continue working from home if they can, and to try to limit or reduce interactions? I mean, what else would keeping safe mean?
Hello. Hey, how are you? Nice to meet you. You well? Yeah, good. We do this. Oh, yeah, good. Hello. How are you? Hello. Hi there. Thanks to our world-beating vaccination program, today we're able to return to Plan A, and we're able to do that as a country because of the phenomenal success of our booster program. We're the most boosted country in Europe, thanks to the NHS and pharmacies like this, and the millions of people that came forward. Over 90% of over 50s boosted. As I said, the most boosted in Europe, and it's because of that we're now be able to begin a new chapter. We see Omicron in retreat, and we begin the road of trying to find all the best ways to learning to live with COVID. And today I'm particularly pleased to announce that we'll be removing a huge number of restrictions that were put on care homes during the Omicron crisis. And from Monday, care homes will be able to have unlimited number of visitors, and we'll also be significantly cutting the self-isolation period. And again, we're able to do all this because of the success of our vaccination program. And I would just urge everyone who still hasn't come forward for whatever reason, for whether it's their first jab, their second or their third, please do come forward, protect yourself and your community.